Good evening, and thank you for joining the call. We're going to get started here in just a moment. So again, we thank you so much for joining the call, and we'll get started here in just a moment. We want to remind everyone that for the most up-to-date resources and information, please visit coronavirus.dc.gov. Again, that is coronavirus.dc.gov, and we'll get started here in just a moment. Thank you. Good evening, and thank you so much for joining our call. My name is Tomas Telemonte, and I'm Deputy Chief of Staff to Mayor Bowser. We want to thank each and every one of you for joining this call tonight as we speak tonight with healthcare workers across the District of Columbia. As a reminder, for the most up-to-date information and resources, we ask that you visit coronavirus.dc.gov. In a moment, you'll hear from Dr. Nesbitt. And we want to remind everyone at a segment in the call, we're going to do Q&A, where you'll be able to press 0 to ask any questions of the administration. And so we'll get to that portion a little bit later. But now I want to pass it over to Dr. LaQuandra Nesbitt with DC Health. Dr. Nesbitt?
Thank you, Tomas. And thanks to all of you who have made the time today to join us for this important call to have the opportunity to discuss with all of you our critical plans that we are making to be responsive to the impacts of COVID-19 in our community. I want to thank all of you for joining our call, this important call with healthcare workers who provide care on a daily basis to the residents of the District of Columbia, as well as residents of our neighboring jurisdictions, as we know that our healthcare facilities in the District of Columbia are world-renowned, and that you all as healthcare professionals who work here in the District of Columbia not only provide an extraordinary service to our residents, but have a tremendous responsibility here in the National Capital Region. This is a critical time for us, in healthcare, a critical time for us in public health, responding to this COVID-19 pandemic. As you all know, we recently announced the District's 3 priority groups for testing in the District of Columbia, which are aligned to those that have been identified by the U.S. Public Health Service. And those priority groups do identify healthcare facility workers as a designated priority group. At any point in time, I want you to know that if you experience any of the symptoms for COVID-19, please know that you qualify for testing through the district's drive-through and walk-up site at the United Medical Center that will go live tomorrow. We did have some opportunity today to be able to present that site to members of our community through a pilot that we had with our first responders, but that site will be open to anyone who has a referral from their healthcare provider, and we are prioritizing testing to you all as healthcare providers. Within the coming days, my team and I will make sure you are equipped with the necessary information that outlines how to make an appointment for that testing and what credentials you should provide when you arrive at the testing site. While we do prioritize this testing site for D.C. residents, we are making sure to make some exceptions for healthcare workers who provide care and services here in the district. We want to make sure our medical workforce who cares for residents of the district on a daily basis know that we care about you and your health. On that note, we have partnered with the D.C. Department of Public Works, one of the strong partners for us here in our Emergency Operations Center that is located at the main headquarters of the Department of Health, and they have made deliveries of personal protective equipment to hospitals and healthcare facilities across the district. And when we say healthcare facilities, I want to make sure people understand that that also includes our home health agencies in terms of making sure that they have the personal protective equipment that they need to continue to care for some of our most vulnerable residents who receive care here in the district in their homes. We've heard your request, and we are working very hard and diligently to get the materials you need to you, to the organizations that you work for, and to all of so that you can provide the services that you need to all the patients who are in your care. I also know that we have others on the line who may be retired or inactive healthcare licensees, and I want you to know that we need you as well as the active license. I'm asking all of our currently active and inactive retired licensees to really consider the role that you can play in the district's response to COVID-19. We know a lot of the national conversation has focused a lot on our first responders and our physicians and our nurse community who are actively working in our hospital environments, but we know that it takes a huge group of health professionals to be able to be responsive to the impacts of COVID-19 in the District of Columbia. Specifically, I'm asking or requesting assistance from providers who are actively licensed, providers who have retired or placed their license in an inactive status within the past 5 years, to really work with our health professional licensing teams in the Health Regulation and Licensing Administration here at DC Health to understand what you can do to be a part of our response. We've taken a number of actions in the District of Columbia to allow you to get back into practice outside of the traditional requirements that would be necessary for you to get back into practice. This request is not limited to just physicians, nurses, respiratory therapists, and physician assistants or advanced practice nurse practitioners, but it also includes any practitioners who feel they can provide assistance, including dentists, pharmacists, surgical assistants, trauma technologists, mental and behavioral health professionals, allied health professionals, and nursing assistant personnel. We need all hands on deck to really have a comprehensive response into our anticipated medical surge needs. If you are interested, we want you to be in contact with the health professional licensing organizations, but you can also register with the District of Columbia's Medical Reserve Corps at dc.gov/MRC. And once you're registered, a representative will contact you with additional information and details on how you can assist during this response to COVID-19. I do want to make sure, before I close and we have the opportunity to take questions, to just reiterate that as a family physician who's been working in public health for the past decade or more, and also being able to really understand what it's like to be in family medicine and urgent care environments, that we are all recognizing that these are unprecedented times, and that even in conversations with my mentors earlier this morning who also practice primary care, these are unimaginable times for many of us, and we truly recognize the emotional and mental and physical toll that working in these environments during these times are taking on our healthcare professionals. And we really want to commend you for your leadership during these times, for your commitment to our patients and our residents in the District of Columbia during these times. And we're here to support you, and above all, to really say thank you. To say thank you on behalf of the 700,000-plus residents in the District of Columbia, the millions of residents who live in the National Capital Region who are relying on you to make sure that their children come home, that their parents come home, that their grandparents come home, and that most importantly that we are doing all of the things to help you stay safe so that you also can come home to your family and friends and loved ones. So I just tremendously want to thank all of you for everything that you're doing and want to make sure that we can continue to keep the lines of communications open and have this pulse check with you as the people on the front lines. So we'll turn it over to have questions.
Yeah, thank you, Dr. Nesbitt. And actually, we're going to now hear from Mayor Bowser. So, Mayor, you are able to go now.
Okay, thank you, Tomas, and thank you, Dr. Nesbitt. And I just want to start by saying thank you to all of our health workers, and thank you for taking the time today, but more importantly, thank you for being there on the front lines and taking on this virus head on with courage and compassion, and risking your own lives to save the lives of Washingtonians. We know that you're putting in long hours. We know that you're leaving loved ones and working many shifts. And we also know that you're worried about what comes tomorrow and what comes in the weeks ahead. This must be emotionally, mentally, and physically exhausting, and I know that you're worried about the health of your friends and families as well as your own safety. So I wanted to reach out to hear from you, to let you know that we are so grateful for you, that we're all in this together. And I want to thank my own team of medical professionals here that work for D.C. government, led by Dr. Nesbitt and the Department of Health, who are putting the very best thinking and planning and modeling behind the work that they're doing. And our decisions in D.C. government have been driven by the medical facts and what we are encountering on the ground, and the decisions that we're making are to make sure that you have that we don't have hospital rooms, emergency rooms, ICUs, ventilators overrun when the surge of this pandemic hits D.C. So we will continue to do all of those things and be here to support you. So I wanted to just stop now and let everybody know that we will. I'm not sure if Dr. Nesbitt got a chance to mention this, but tomorrow I will be making a presentation to the council that outlines how the district, in partnership with our hospitals, will meet the surge demand that we expect to hit D.C. hospitals. So with that, again, I want to say thank you, and we have time to hear from you now.
All right, thank you, Mayor. And again, for everyone on the line, if you would like to ask a question, please press 0 now, and you'll be added into our question queue. And we're first going to go to our first question, Melanie Mitchell. Melanie Mitchell, your line is unmuted. Melanie? All righty.
Yes, I'm here.
There you go.
As a clinical social worker in the District of Columbia, I'm wondering how would my efforts be utilized to support this effort in COVID-19?
Thank you so much for the question, Melanie, and it's a critically important question. We have had lots of discussion in terms of the impact of COVID-19 on our physical health, and we recognize that there's been a tremendous amount of fear and anxiety that people have around COVID-19. And so we're really appreciative of the behavioral health specialists, including clinical social workers, who want to be a part of the response. We would ask that you and other social workers sign up for the Medical Reserve Corps. Our Department of Behavioral Health has been providing lots of consultations to individuals through their 24/7 line. We're providing individuals with information about maintaining your mental health. And as our medical surge needs increase and we have the ability to provide more services to individuals, we want to be able to rely on our behavioral health specialists throughout the community as an asset that could provide individuals additional support.
All right, thank you, Dr. Nesbitt. We'll go to our next question. It is from Wally, registered nurse for home care. Wally, you are live.
Hello, I just want to find out, is there going to be any effect on this pandemics regarding renewal of licenses in D.C.?
Yes, so we have a lot of authority during a public health emergency in terms of how health professionals can work in the District of Columbia. We've taken very swift action in terms of allowing health professionals who are licensed in other jurisdictions to be able to work in the District of Columbia during a public health emergency. As many of you know, as a licensed health professional, a licensed, certified, or registered health professional in the district, our licensure cycles occur on 2-year periods of time, depending on what health profession you practice, and the licensure cycles are also very predictive. They all expire at the same time. They don't expire on dates of birth or other time frames similar to a driver's license. Because of that, we're able to very closely monitor any of our health professions that may be coming up for renewal as we respond to the pandemic, and we'll be making decisions related to the need to extend license expirations as the time allows.
Thank you, Dr. Nesbitt. We'll next go to Dr. Spiegel. Dr. Spiegel from NIH, you are unmuted.
Thank you. Thank you, Dr. Nesbitt. Thank you, Mayor Bowser, for this initiative. I'm Dr. Spiegel. I'm a senior medical officer at the National Institute of Allergy and Infectious Diseases and trained in pediatric infectious diseases. I'm licensed in D.C., and I have gone through all of the training here for the Reserve Corps in Maryland also, but have also registered for the D.C. Reserve Corps. The question is, when can we start?
Thank you for the question, Dr. Spiegel, and I'm so pleased and proud to hear that you are a licensed physician in the District of Columbia and a member of the Medical Reserve Corps. We have already begun to deploy members of the Medical Reserve Corps for specific assignments. Individuals, based on their availability that they have entered and their health professions into the Medical Reserve Corps, will be deployed based on assignments and our needs. We will deploy more individuals as our response matures, and more members should be on the lookout for requests from us for deployment.
Thank you. Our next question is from Jonine Windham. Jonine, your line is unmuted.
Hi, my name is Janine Williams, and I'm a nurse manager with Trusted Health Plan, District of Columbia. Mayor Bowser and Dr. Nesbitt, thank you so much for having this opportunity to also partner with you to take care of our district residents. My question was, if you could please repeat the web address in which we would use to sign up as a volunteer, and are there other opportunities that you may have where we're able to do that remotely as well?
Yes, so the D.C. Medical Reserve Corps, you can sign up at dc.gov/MRC. And when you sign up, you enter information in the application process that will allow us to best identify how you can be of use in the response. And some of those assignments may include the ability to work remotely or to assist in some of the other aspects of our response. We do have data and surveillance opportunities that are available. We have clinical opportunities that are available, and we also have logistics opportunities that are available. While this call is dedicated to the healthcare workers and healthcare professional community, we do have opportunities for individuals who are not health professionals. So if you have family and friends who would also like to assist in the response, they can sign up as well.
All right, we'll go to our next question. John Ori from MedStar. John, you are unmuted.
Hi, thank you so much. My name is Chand, not John. I'm a physician hospitalist in Washington, D.C. I wanted to understand exactly, and I've been trying to find this, the number of tests that we are conducting right now in D.C. for the community. And so if there is a number, that would be great. And what is the projected number that we are looking for in the coming weeks to help mitigate the spread?
Well, thank you for the question. As healthcare providers, the doctor decides who gets tested. We are constantly seeking to increase the availability of the swabs that clinicians use in the office to collect the nasopharyngeal specimens. And so that, we know, has been a barrier for some of the physicians and nurse practitioners who are in independent practice offering testing in their environment. I am pleased to report that our testing has increased in the district from 300 tests per 1 million in the middle of March to 4,000 tests per 1 million at the end of March. So So there are great indications that the availability of testing has increased in the district. We know that increase has been caused because of more tests being available, test kits being available, more reagents being available, but also because more places for testing has increased.
All right, we'll go to our next question. And want to remind everyone, again, if you have any questions, please press 0 and you'll be added into our question queue. And being cognizant of time, we have time for just a few more questions, so we're going to go next to Ken Blank. Ken, you are unmuted.
Thank you very much, and thank you for your time and leadership, Mayor Bowser and Dr. Nesbitt. So I'm an OB-GYN in Washington. There's a group of 14 of us, and a few weeks ago, the Department of Health sent out a questionnaire inquiring as to who might need PPE for their office, which we do. We're essentially out of anything and even masks. So I was wondering, is there any thought of, and are private offices going to be able to acquire some of the PPE you're distributing, and where on the list would they be? And I did respond to the email that, again, that we did need supplies, but if we still need supplies, is there a way, should we be following up with you in any particular way to try to obtain whatever PPE is available and to a private office, as we're still seeing our OB patients, but on a modified schedule, and we're still seeing emergency GYN patients as they need to be seen, not doing anything routine.
Thank you for the question. So we have been working very diligently to make personal protective equipment available to a number of entities that are requesting personal protective equipment making requests for personal protective equipment to the Department of Health, and have a strategy for being able to deploy that personal protective equipment. This week, we did deploy some personal protective equipment based on the results of surveys that happened. I'm glad to hear that you all were able to respond to that survey. The deployment that occurred this week, about 4% of the PPE that was deployed to hospitals, skilled nursing facilities, clinics, home health agencies, dialysis providers, and private providers, about 4% of that personal protective equipment was sent to private providers. What we use to determine what goes to what types of organizations is based on how much PPE you're consuming and what types of population you're serving, and the risk to the healthcare providers in that community of COVID-19. We are doing our best to be able to meet the personal protective equipment needs of the healthcare provider community, but similar to other jurisdictions and to the federal government, we are facing some of the same procurement challenges that you all are having in terms of accessing your supply chain. We are continuously and on a day-to-day basis, we have an entire group here at our Emergency Operations Center that works to procure personal protective equipment daily. And as we continue to procure personal protective equipment for what we refer to as our local strategic supply, we will continue to deploy that to you all as healthcare providers. So please continue to respond to those surveys, and we will deploy what we can to you as it is available to us.
Thank you, Dr. Nesbitt. We have time for just one more question. We're going to go to John Frill. John, your line is unmuted.
Hi, thank you, Mayor Bowser and Dr. Nesbitt, for your time and service in this time of crisis. My question is this. I'm a teletherapist in Virginia and D.C. How can we as clinical social workers, therapists, and counselors assist you in what message do you want us getting out there to your population, aside from staying at home and staying safe?
So I really appreciate this question, and it's a very good one, and there is a message that we want you to amplify. We want you to make sure that people know that they should reach out for help especially for mental health, that is critically important. As much as we can continue to break down barriers related to stigma for behavioral health, we want to be able to do that. We know that there is a benefit of exercise to help reduce stress and anxiety, and while we want people to stay at home, it is still okay to step outside to get some fresh air or to do a fitness routine within your home. As you mentioned, we are emphasizing a message of staying at home, so we want people to limit time spent in public spaces. You can message to people if they are working from home or in self-quarantine, that they should arrange their space at home so that it is calming, and that they should still make sure to shower and get dressed every day as if they are going to work. That has a tremendous impact on your social and emotional health. There's a lot of information out there. We live in a 24/7, 365 news cycle, but we have to be mindful to moderate our news intake and the influx of information that we get as a way of protecting our own emotional and mental health. And then the last thing, and it's one of the things that I'm mindful to do in the workplace, is to practice deep breathing exercises or other methods of meditation as a way of protecting our own emotional and mental health.
Great. We're actually going to take two more questions. So we're going to go next to Alicia Rucker. Alicia Rucker. You are unmuted, Alicia.
Well, thank you so much. Madam Mayor and Dr. Nesbitt, I wanted to thank you all for representing the district so very well during this pandemic. I have two questions. One, if we're under the impression that we don't know how many people have COVID-19 because we don't have enough testing, then should we also assume that everyone is contaminated? And how many patients do you expect to see during the surge?
We do want to make sure that people follow very closely with us tomorrow. We're going to be talking much more publicly about our medical surge planning and the details that are behind our medical surge planning, including overall estimates that we have. I do want to make sure that while there is a lot of discussion around rates of transmission and pre-symptomatic versus asymptomatic individuals who may be carriers, there's still a lot that we are learning in the scientific community, and we do not make the assumptions that everyone is a carrier of COVID-19 with the ability to transmit.
All right, and we'll go to our final question. Just 1 second as we load up the question here. We're going to just 1 second. Alicia Gibbs. Alicia, you are unmuted.
Hi, this is Dr. Alice Fuse. I'm a general internist, and our primary care practice has gone basically to 100% televisits in the past 2 weeks. But at the same time, our income has completely plummeted because we're just seeing literally through these televisits only a couple patients a day, and yet we're responding to refill requests. We're taking a lot of phone calls. We're answering a lot of portal questions, but we're really making very, very low income. So my question is there any legislation specifically aimed at helping keep medical practices open? Because I'm afraid if we have to close our doors, then, we've got several thousand patients out there that won't have access to primary care.
Thank you for the question, and we've been in contact with a number of healthcare providers in a number of practice settings, including those individuals who are in primary care, ambulatory care, and other situations. And we do appreciate and understand the impact of eliminating elective procedures and shifting to a telehealth platform may have financially on healthcare providers. There are some things that have already been done in terms of health insurance companies being able to compensate for telehealth in a way that they weren't doing so previously, especially as it relates to public insurance being able to do that. And we've seen some of the commercial providers follow suit. We are always looking at ways that we may be able to be responsive to that as we continue to monitor the economic impacts of COVID-19 as well as the public health impacts.
Thank you, Dr. Nesbitt. And again, we just want to remind everyone, thank you for being on the call, and for the most up-to-date information and resources, you can visit coronavirus.dc.gov. To close out our call, we're going to go back to Mayor Bowser. Mayor, go ahead.
Thank you, Tomas, and thank you, Dr. Nesbitt. And I want to thank everybody for signing in. I understand that we have 1,800 doctors, nurses, social workers, and other healthcare professionals on the line. And again, we are working very hard. I just mentioned to my staff as I was listening to your questions that I love this call. We're hearing directly from the front lines what you need, and it will definitely inform our planning and how we're executing for frontline workers. So thank you so much for taking the time.
Thank you all for joining the call, and we thank you for being our heroes every day. Thank you.